Hello and welcome to the StarTimes Daily COVID-19 Report. Here we'll continue to bring you the latest news and developments on the coronavirus pandemic. We'll also provide some valuable advice on how to stay safe from COVID-19 infection. I'm James Oliver. First off, in COVID-19 by the numbers. As of April 23rd, COVID-19 continues its spread and has exceeded 2,630,000 confirmed cases globally. So far, there have been 30 countries with more than 10,000 confirmed cases around the world. In Pakistan, the number of confirmed cases has now exceeded 10,000, while in Austria and South Korea, the rate of the pandemic spread has significantly decreased.
As of April 23rd, Worldometer data shows there are 2,633,309 confirmed cases and 183,930 deaths reported globally. In the past 24 hours, 77,549 new cases have been confirmed around the world, with the United States leading the list with 28,163 new cases in a single day. That's followed by Russia with 5,236 and the United Kingdom with 4,451. Spain and Italy ranked 4th and 5th. On Wednesday, Pakistan reported 511 new cases of coronavirus, while the total number of cases has surged to 10,076. So far, there have been 30 countries with more than 10,000 confirmed cases of the virus. Recently, the Pakistani government has increased its rate of detection. At present, about 118,000 people have been tested. Earlier, the Pakistani Prime Minister Imran Khan announced an extension to 30 days of city closures of varying degrees across the country. In Austria, the spread of the epidemic has slowed significantly, with the number of new confirmed cases falling below 100 in a single day for several consecutive days. Austrian Chancellor Sebastian Kurz said at the press conference that the measures to prevent and control the epidemic have achieved good results, and the government will release specific plans to relax restrictions and resume work and production in a 2-week period to guide the society to gradually return to normal operation.
The COVID-19 epidemic has diverged in different regions of the world, with countries reporting varying growth and decline. In some cases, there have been resurging numbers in areas where the COVID-19 pandemic appeared to be under control. The World Health Organization warns that the coronavirus remains extremely dangerous, and it might be with us for a long time.
On April 22nd, the World Health Organization Director General Tedros Adhanom said at a press conference, at present the COVID-19 epidemic has diverged in different regions of the world. The pandemic in Western Europe appears to be stable or declining. However, the WHO also expressed concerns of upward trends in Africa, Central America, South America, and Eastern Europe, despite low case numbers. The WHO's top officials stated, "Make no mistake, we have a long way to go. This virus will be with us for a long time." While social distancing measures put in place in numerous countries to slow the spread of the coronavirus have been successful, the virus remains extremely dangerous, Tedros said. He noted that current data shows most of the world's population remains susceptible, meaning outbreaks can easily reignite.
Italy is set for phase 2 of its approach to the coronavirus pandemic. Premier Giuseppe Conte announced that Italy will gradually resume economic activities starting on May 4th. This measure will see people return to the workplace, but not everyone will be back to work just yet. Conte has stated the plan will involve the return of 2.7 million workers at most.
According to Italian newswire ANSA, on April 22nd, Italian Premier Giuseppe Conte told unions in a video conference that the manufacturing and construction sectors may resume operations on May 4th, along with some commercial enterprises. He said Italy is set to ease coronavirus lockdown starting from May 4th. There would not be an indiscriminate easing of the lockdown because that would be irresponsible. The rules will not be lifted, but recommendations will be adapted to the new phase, he said. Task Force head Vittorio Colao said the resumption would involve 2.7 million workers at most. The Italian government was also discussing the possibility of allowing social activities inside of communities from May 4th while implementing restrictions on cross-regional activities.
Now checking in on the situation in Africa. As of April 23rd, 52 African countries have reported COVID-19 infections, with over 26,000 confirmed cases across the continent. In Egypt, the number of confirmed cases is quickly approaching 3,700, maintaining its place as the most infected African nation, followed by South Africa and Morocco.
The spread of COVID-19 continues to increase in Africa. As of April 23rd, Eastern Africa time, there are 52 African countries with confirmed cases. Altogether, there are 26,653 confirmed cases of the virus across the continent, with 1,244 deaths and 7,315 recoveries. On April 22nd, Egypt reported 169 new cases, recording the highest number of confirmed cases with a total of 3,659 confirmed cases in Africa. The Egyptian president vowed on Wednesday to repatriate about 3,500 citizens stranded abroad amid the country's efforts to protect expats from COVID-19 pandemic. Morocco reported 237 new cases with a total of 3,446 confirmed cases. Algeria reported 99 new cases with a total of 2,910 confirmed cases there. On the same day, South Africa reported 170 new cases with a total of 3,635 confirmed cases. That's the second highest in Africa behind Egypt. Ghana reported 112 new cases with a total of 1,154 confirmed cases, recording the highest number of confirmed cases in West Africa. Cameroon reported a total of 1,163 confirmed cases, recording the highest number of confirmed cases in Central Africa. Djibouti reports 29 new cases, still recording the highest number of confirmed cases in East Africa with 974. There are 303 cases now confirmed in Kenya and 116 confirmed cases in Ethiopia. In the past few days, the number of new COVID-19 confirmed cases in Africa has slowed down. The pandemic has now plateaued, and there are no signs of large-scale outbreaks.
Since 4 infection cases were confirmed on April 11th, South Sudan has reported no new confirmed cases of COVID-19 for 11 consecutive days. In order to enhance the medical treatment and prevent the spread of the virus, South Sudan is increasing access to life-saving treatments for COVID-19 patients.
According to the South Sudanese government, as of April 21st, the confirmed COVID-19 infections in South Sudan remains at 4 cases. The nation has reported few new confirmed cases over the last 11 days. As of now, the Health Ministry of South Sudan has traced and tested 99 close contacts of the confirmed cases. 36 of them now have finished their quarantine procedures. To alleviate the country's hospital bed shortage designated for COVID-19, the government and World Health Organization are cooperating on the expansion of the Dr. John Garang Multi-Purpose Infectious Disease Unit in Juba, expanding it from a 24 to an 80-bed capacity treatment center, a temperature-controlled dispensing pharmacy, and a fully equipped laundry facility to enhance infection prevention and control. According to health ministry officers, an expansion of 10 more rooms is already finished, and the entire expansion project will be finished in 10 days.
The number of newly confirmed COVID-19 cases across Africa has continued its decline, with the pandemic's growth beginning to plateau off. In order to reverse the negative economic effects of the virus, some countries have started to gradually deregulate national lockdown policies. The Tanzanian president said on Wednesday that he would rule out a lockdown of the nation's biggest city Dar es Salaam amid the COVID-19 pandemic.
On April 22nd, President John Magufuli of Tanzania has ruled out a lockdown of business capital Dar es Salaam amid the COVID-19 pandemic. He stated the move was aimed at saving people from difficulties and saving the country from an economic meltdown. Magufuli urged people to stop panicking, but observe preventative and protective guidelines regarding the virus. At the same time, they should participate in national building activities. He also urged the heads of defense and security organizations to take punitive actions against people, including politicians, who were spreading false information about COVID-19. The country has so far reported 284 COVID-19 infections, with 10 deaths and 11 recoveries.
Now it's time for Staying Safe. Here, we'll give you some tips to help you avoid COVID-19 infection. In today's topic, coronavirus prevention measures for attending a conference or a meeting.
Guidance for businesses. Meetings. Advise employees to wear masks and wash hands before entering conference rooms. Make sure that employees maintain a distance of 1 meter or more from each other during meetings. Reduce the number of and length of meetings. Open windows to ventilate rooms during meetings. Disinfect rooms and furniture after meetings.
Well, that's all for today's program. Don't forget to tune in to StarTimes Daily tomorrow for the latest COVID-19 developments, along with some useful health advice. Now we're going to leave you with a video of 50 football players, including some real legends, saluting the healthcare workers and other professionals fighting on the front lines against COVID-19. I've been your host, James Oliver. Thanks for watching, stay safe, and we'll see you soon.